BBC Two for the East. Now here's Stephen Rhodes with the East at Westminster.
A new animal testing centre for Cambridge. If you've got a view, you can call us now on 08457 630 630.
The eyes to the right. With the right honourable gentleman.
Here.
Good afternoon. Now, it's been described as a test case for the future of animal experiments in Britain. Cambridge University is trying to convince a planning inquiry that a multi-million-pound research centre should go ahead. Now, to objectors, it's a house of horrors that will mean the death of thousands of monkeys. Local councillors have already rejected the scheme twice, and now the government will have the final say. David Woodthorpe has this report.
No more monkey labs! No more monkey labs!
There is enormous opposition to this laboratory.
Say no to primate labs!
We cannot have vital work stifled simply because it is controversial.
No Girton primate lab!
Two very different camps, no common ground. And it falls to this planning inquiry to decide the fate of the proposed £24 million Cambridge University Neuroscience Centre. At stake, say its supporters, is the future of brain research, scientific expertise and jobs in Britain. To opponents, the lives and unnecessary suffering of thousands of monkeys. Scientists at Cambridge University are world leaders in research into the human brain. They say the new centre is the key to that continued leadership.
It's very important because this is a very impressive team of scientists we've got together doing this exciting work. And if we lose this one, then I'm afraid the team may disperse and go and do the work elsewhere, probably abroad, because if this doesn't go through, there's going to be a problem elsewhere in the UK, I think.
To animal rights activists, this is the face of unacceptable cruelty at existing research labs at the university. Undercover footage shot by the British Union for the Abolition of Vivisection of marmoset monkeys, their heads bearing the scars of recent brain surgery. Cambridge denies it's done anything wrong.
We're opposed to this centre for two reasons. Firstly, because we think it's morally indefensible to experiment on primates in this way. We've exposed a huge catalogue of suffering here at Cambridge and the public do not want this work to carry on. We're also opposed to this centre on scientific grounds. We think the time has come to invest in more modern, humane, alternative techniques that don't use animals rather than continue with the science of the past.
Wishful thinking, say supporters of the proposed centre.
Well, anti-vivisection campaigners have been claiming that animal experimentation doesn't work, it's bad science and it's all horribly cruel for probably over a century now. But the facts are quite simple. Medical history has shown that almost every major medical breakthrough has depended on animal experimentation.
This is the site that's causing all the controversy. At the moment, it's a university farm, but it could become the focus for the sort of violent protests that have been seen elsewhere in Cambridgeshire. Huntingdon Life Sciences has long been the focus of demonstrations by activists opposed to animal experimentation. More extreme elements have targeted the homes and cars of scientists, while HLS's MD, Brian Cass, was hit with an iron bar. Activists are clear what will happen at Girton if the Cambridge Centre is built.
Girton is an obscenity. What the animal rights movement, and I think a lot of the local population will do, they will bring Cambridgeshire to a standstill. At the end of the day, we campaigned against the cat farm, and over 18 months the police bill was £5.4 million. You know, I can really easily see an annual police budget for police in Girton being between £5 and £10 million. Are people really prepared to lose essential services in Cambridgeshire?
Cambridgeshire police say a repeat of the HLS experience will cost the force another £1 million a year. It's objected to development of the site in Girton.
We anticipate a rise in crime and disorder associated with protest activity at the site or nearby, and an increased risk to public safety because of the road network which is in the immediate environments of the proposed site.
Local planners have twice rejected the university scheme, but people living in Girton seem more relaxed about the development.
We need research. If people are not willing to experiment on people, I think we've got to experiment on animals.
I can't see a problem with it being
on the edge of Girton.
Oh, I think it's a very good idea. I think we need more of them. And the other blighters are against it. I'm afraid I would have to be very rude to them.
Earlier this week, Science Minister Lord Sainsbury described the centre as of national importance. Objectors believe the planning inquiry is a sham.
Unfortunately, what we're witnessing here is a bit of a show trial. The Prime Minister has already given his support for this centre, and now he said the Deputy Prime Minister will make the decision. There isn't much independence or balance in this system.
A decision about the future of the Neuroscience Centre is expected early next year. David Woodthorpe for the East at Westminster.
Well, don't forget, if you want to comment on that, you can give us a call on 08457 630 630, and then you'll be joining us on the programme shortly. Here in the studio with me is Dr Ian Gibson, who is Labour's MP for Norwich North and Chairman of the Science Select Committee. And in Westminster, we're joined by Dr Ray Greek from Animal Aid. Going to you first of all, Ian Gibson, all this business is really just a bit of a sham. The government are going to have their way and this will go ahead.
No, I don't accept that. I think the inquiry will be looking, as your film shows, into traffic problems and any kind of activity by groups who protest against the centre, and the police are very concerned about that. We want the police to be doing the important things in life, not controlling crowds necessarily every weekend.
This whole project has already been turned down locally twice, so...
Yes, I don't know the exact grounds on it. I imagine it was something to do with traffic and what I've just indicated.
Yes.
And if that came up again, then it is not inevitable that the Deputy Prime Minister would go down on the side of saying it must be built. I think it will be a very neutral inquiry, and there'll be many people inputting into it.
Do you think we have to have a centre like this in Cambridge?
Oh, I do. I think we have to have one in this country. I think that the developments in genetics now are going to demand, and the neurosciences indeed, are going to demand that we go through animal testing as part and parcel of the process of getting new medicines into the human race.
And you're saying that's the only way to do it?
Well, it's not the only way. I mean, there are certain conditions where you can do in-tissue culture work and in vitro tissue culture, but that's not advanced to the extent that I would like it to have advanced. More and more research is going into that. At the minute, I think there's plenty of evidence that going through animal experimentation saves a lot of human lives and allows us to develop drugs without toxic side effects and so on. I think it's
okay, let me go to Dr. Ray Greek on that. What about that? It's vital.
No, I'm afraid not. Actually, it's just the opposite. Developing drugs on non-human primates, such as monkeys, actually delays good cures that could come to market, and it prevents some good cures from coming to market. And anyone with any knowledge of evolutionary biology or molecular biology, or as Dr. Gibson pointed out, genetics, should be able to ascertain this. Science has outgrown the need to use non-human primates. Doing so is simply a waste of time and money. And not only that, but the ethical issue here that I think has largely been ignored is the human ethical issue. We have many people suffering from diseases like Parkinson's, Alzheimer's, and multiple sclerosis. I personally have family members with each of those diseases. I know the suffering involved.
But are you telling me...
as long as people are experimenting on non-human primates, my family is not going to have cures for the diseases that they need.
So are you telling me that these Cambridge scientists have got it wrong?
Absolutely, and the reason that they've got it wrong can be explained scientifically by evolutionary biology, molecular biology, the Human Genome Project.
Okay, well, let me bounce that one back then, Dr. Ian Gibson.
No, I just think they're in
Cambridge has
complete
got it wrong.
disagreement on it. Not at all. I think with stem cell advances for Parkinson's and Alzheimer's, etc., coming up and looming up because of the government's decision to do that research, we have to go through the animal experimentation stage.
And there's no option to that at all?
Not at this minute. There isn't. I think it's necessary to find out what the effects might be, rather than going straight into clinical trials with people where there may be dreadful side effects. I can give you lots of stories, you know, when we get to the human stage, and I'm sure Dr. Greek would agree with me, you know, where the side effects in animals have helped us progress the trials in human beings.
And are you saying, Dr. Ray Greek, are you saying, Dr. Ray Greek,
Dr. Gibson, give me some examples of those, because I certainly don't know of any. As for stem cell research, we grew stem cells from mice in the 1980s. It took another 20 years before we could grow them from humans. The way we grew those stem cells from mice simply did not work in human stem cells, and that's the crux of the problem. What works in a mouse or a monkey usually does not work in a human being. And again, I think the real ethical issue here is the human ethical issue. People deserve the best medical care and the best medical research that their tax and charity dollars can buy.
Let me just take Dr. A. Greek on one point. Are you saying that you would prefer your relatives to be next in line for this treatment rather than trying it out on monkeys first of all?
In terms of stem cell research in Parkinson's patients, I have tried to get my uncle to participate in clinical trials where that is ongoing. We've already put stem cells into human patients. To go backward in time, and may I just say that this proposed Cambridge Center would be doing just that, going backward in time. It would be a monument to the past.
So why do you think in this case that the British government have taken a stance on this kind of thing and they say it's vital and necessary? You're saying they've got it wrong too. Everybody's got it wrong on that side of the argument.
I think all the people have in common is a vested interest in the situation. I don't have a vested interest in the situation. Okay. I'm a scientist and a physician, and I practice medicine. I am concerned about the suffering of human beings, and I'm saying, from no vested interest whatsoever, this is a bad idea.
Okay, let's go to the phone lines. And first of all, our first caller is Tony Butcher from West Mercia. What did you want to say, Tony?
I would like to ask if politicians can give us concrete proof that animal testing will benefit the human race forever. I tend to think that no one is thinking about the benefits to humans or the animals. I think they're just thinking about money.
What about that, Dr. Ian Gibson?
That's certainly not my motivation, as you well know. I have no personal interest in what happens at Cambridge, but I'm interested in science and technology and advancing our knowledge. And I am absolutely sure that we will benefit as a human race from testing certain cells and types and drugs and chemicals in animals so that we find out what they might do in terms of certain organs before we put them into human beings.
But as a scientist, did you approach this whole argument with an open mind, or were you already of a mindset that you have to use animals?
I'm very biased for science and technology. I think it advances the cause of the human race.
I'm asking how you approach this question.
I approach this question in an intellectual way, saying, can we find out from tissue culture experiments enough about the way cells work together, about the whole physiology of the animal, you know, from working with cells and culture? And intellectually, I say you can't. You have to try it on some kind of organic system. So you are saying to Tony
there is concrete proof that this is the way to go, and the benefit.
We've had debates on this in Parliament, and there have been examples. I've given them myself from scientists who worked in Manchester and other places about where animal testing really told us not to use this particular new chemical or drug.
Is there anyone that you can specify at this moment in time?
No, I
would. To Dr. A. Greek?
Well, I mean, he knows the work of Nancy Lane at Manchester. Her work is outstanding, and she absolutely argues for testing on animals as part of the
Quick word on that, Dr. A. Greek?
Two comments, if I could. Number one, Dr. Gibson did not answer your question. He did not give you any specific examples. And number two, the reason that I don't think that experimenting on monkeys is going to help humans can best be exemplified by what happened in the United States between 1998 and the year 2001. During that time, 10 medications were withdrawn from the U.S. market. Of those 10, 8 were withdrawn because of side effects that occurred primarily, indeed almost exclusively, in women. Now, if men cannot predict what a drug is going to do in a woman, how on earth can a monkey help us understand human disease?
Tony, anything you want to add to that?
I would just like to say also that I think animals and humans have all got to live on this earth together, and I think the animals are having a pretty rough time of it.
Okay, Tony, thank you very much. Let's move on to our next caller, who is Vicky Cowell of the campaign group Seriously for Medical Research.
Hello. In fact, it's Seriously Ill for Medical Research.
I do beg your pardon.
Hi. We're a patients group. I'd actually like to ask the question that if this is an ethical issue, is it ethical to stop this research from going ahead if it has the potential for saving thousands of human lives?
What about that, Dr. Greek? Is it ethical to stop this if it has the potential to help?
Anything has potential. That's not the issue. In science, we talk about probabilities. And the probability of clinical research, functional MRI scanners, and so forth, aiding doctors like myself who practice medicine is outstanding. The probability of a non-human primate, such as a monkey, helping to ease the suffering of Alzheimer's or Parkinson's patients is about the same probability as a drunken pub patron throwing 10 bullseyes in a row. Can it happen? I suppose, but I would not want my life to depend on it.
Does it not reduce the risks, though, to human beings somehow?
No, absolutely not. Many studies have been done, and I think Dr. Gibson is probably aware of some of them. I think that you should ask him if what these studies have shown about drug testing and disease research in non-human primates specifically. He knows very well that many studies in the medical literature demonstrate that there is no correlation between what a drug or a disease does in a monkey and how it acts in a human being.
On that
That's
basis, Dr. Greek, can I ask you what you believe Dr. Ian Gibson's reason for taking the stance he has then is?
I don't know Dr. Ian Gibson. I wouldn't know him if I saw him. But more important than what Dr. Gibson looks like, I do think I would like to see what his portfolio looks like. I would like to see what companies he's invested in and so on and so forth.
None at all, Dr. Rager.
Sorry, hello?
Yes, Vicky.
Can I say something very quickly?
Sorry, let me go back to Vicky, yes?
I'm not an investor in any company, but I am the mother of a daughter who has cystic fibrosis, which is a genetic condition. And I know that all my daughter's drugs have been tested on animals. And my daughter is now 17 because she's been able to take those drugs. If she hadn't been able to take them, she would be dead, and it's as simple as that.
Dr. Greek, quick word from you in conclusion on this.
Cystic fibrosis is a terrible disease, and my heart goes out to the patients and to the families. But the caller is simply factually incorrect. The drugs that have kept her daughter alive were not the results of experiments on animals. In fact, some of the drugs that her daughter takes were delayed because of experiments on animals.
Okay, and I have Dr. Gibson here shaking his head on that one. Let's move on to our next caller. Thank you very much, Vicky. And our next caller lives just outside Cambridge. Rebecca Irving, what did you want to say?
I want to say that I think it is completely unnecessary most of the time to have animals being tested on things, because it's been proven that a lot of the time things have the opposite reaction. Animals have the opposite reaction to humans.
Can I ask how you come by that view? I gather at 12 years of age you're probably still at school, is that right?
Yeah, in my primary school we did a slight thing on some animal testing things, and there was a few books we had, and it was saying things like Prozac frenzied cats, which is a lot of the time different to what happens with humans.
Okay, what would you say to Rebecca?
Well, I think there's a great exaggeration going on here. I mean, I'm against many animal experiments to develop cosmetics, for example. There have been some obscene gestures in trying to test certain kinds of new chemicals. But in terms of the drugs that Rebecca has now, they were tested in animals. Many of them, we learned about toxic side effects and so on. And some of them, indeed, will probably be taken off the market.
And what about Dr. Greek's contention that because of the animal testing, these were delayed in coming onto the market?
No, I don't. He's got to produce evidence of that for me. I know nothing of that at all. I think we are very, very careful about any drug getting through a very complex process before it's given to people, and I would like to protect that. I want to make sure that every stage is necessary to find something out about the
Dr. Greek, isn't that an argument? You talk about delay as a result of animal experimentation. You don't want to rush ahead. You've got to tread carefully with these things.
You have to tread very carefully, and that's why we should not experiment on animals. Fen-Phen, Resulin, Durac, these are just some of the medications that passed with flying colors animal tests and went on to kill humans. Again, if you look at the statistics, which I can document without problem, and which I will document Wednesday at Cambridge, animal testing is basically a toss of a coin. If that's how you want to spend your medical research dollars on something that's the equivalent of a coin toss, I just don't think society is going to agree with you.
Pharmacies are full of drugs that have been tested in animals, and thank goodness they were.
Okay, let me just read a comment here from Trevor Barnes, who didn't want to come on the programme. He says, if this centre is not allowed in the UK, the whole animal experiments operation will go abroad, probably to the third world, where there's little or no animal cruelty regulation. Would that be a risk?
It is a potential risk. That's what tends to happen, when it's banned in this country. I don't think it will be. I think there'll be regulations. It'll be opened up. People will be able to inspect that the welfare of animals is a prime concern. Hopefully that will be, a compromise we can reach.
Okay, Jeff Smith is in Fordham near Newmarket. What do you want to say, Jeff?
Well, basically, it's a very logical question. It's about the laws on cruelty in this country. If I can refer you back a couple of years ago, an Essex policeman was prosecuted for abusing his dog while training it. Now, when these researchers apply for a project license, they have to say the degree of suffering they're liable to cause in the animal species, and that is either slight, moderate, or severe. So they're actually turning the law completely on its head and saying this is the amount of cruelty we are going to inflict on these animals.
OK, what about that? Just in a very brief word, Dr Ian Gibson, is that the point? Cruelty will be inflicted on these animals?
No, I don't think cruelty will be. I think there's cruelty in society against animals, as the person.
But that would make no excuse to have it happen.
Oh no. But I think there are very firm controls over what goes on in scientific labs, and there's Home Office inspectors who come in.
Okay,
regularly,
so there would be controls in that instance
to catch out any misdemeanours, and there have been one or two bad cases which have been played up by the animal rights lobby.
We're going to leave that there, gentlemen. Thank you very much. And that's all the time we've got for your comments this week. But now let's have a look at what some of you had to say about last week's programme on the government's plans for new...
...face of unacceptable cruelty at existing research labs at the university. Undercover footage shot by the British Union for the Abolition of Vivisection of marmoset monkeys, their heads bearing the scars of recent brain surgery. Cambridge denies it's done anything wrong.
We're opposed to the centre for two reasons. Firstly, because we think it's morally indefensible to experiment on primates in this way. We've exposed a huge catalogue of suffering here at Cambridge, and the public do not want this work to carry on. We're also opposed to this centre on scientific grounds. We think the time has...
Enormous opposition to this laboratory.
Say no to primate labs!
We cannot have vital work stifled simply because it is controversial.
No gut and primate lab.
Two very different camps, no common ground. And it falls to this planning inquiry to decide the fate of the proposed £24 million Cambridge University Neuroscience Centre. At stake, say its supporters, is the future of brain research, scientific expertise and jobs in Britain. To opponents,
BBC Two for the East. Now here's Stephen Rhodes with the East at Westminster.
A new animal testing centre for Cambridge. If you've got a view, you can call us now on 08457 630 630.
the eyes to the right.
Would the right honourable gentleman...
Here.
Good afternoon. Now, it's been described as a test case for the future of animal experiments in Britain. Cambridge University is trying to convince a planning inquiry that a multi-million-pound research centre should go ahead. Now, to objectors, it's a house of horrors that will mean the death of thousands of monkeys. Local councillors have already rejected the scheme twice, and now the government will have the final say. David Woodthorpe has this report.
No more monkey labs! No more monkey labs!
There is
the lives and unnecessary suffering of thousands of monkeys. Scientists at Cambridge University are world leaders in research into the human brain. They say the new centre is the key to that continued leadership.
It's very important because this is a very impressive team of scientists we've got together doing this exciting work. And if we lose this one, then I'm afraid the team may disperse and go and do the work elsewhere, probably abroad, because if this doesn't go through, there's going to be a problem elsewhere in the UK, I think.
To animal rights activists, this is the